We just want to make sure we're doing it to the best of our ability, because it's all about getting better and being the best you can be.
So we've been trying to think big picture in terms of what's best for the whole county, not just for what's best for our patients. We're working towards building an overarching coalition for healthcare.
So how do we identify those social determinants of health, and then what do we do about them? Making sure that they have food, making sure that they have shelter, making sure that they're getting their preventative services that they need, that maybe they're totally unaware of.
The center kind of pushed and prodded to think outside of the box of those normal people who you would normally see at the table. And so we have to reach across those lines. It has to be partners that aren't the traditional partners, because more people play a role in health than healthcare itself. And so I love that we have the ability to go out and talk to the community and find out what the community's needs are and figure out how we could fill the gaps in some of those services and work together and make things happen for our family. I mean, it's everyone's family around here.
Our big focus is preventative services at this point, because if we can treat things and get them under control before they are a problem, it is so much easier to promote overall wellness and to longer lives for people, versus if we're trying to respond to a problem that's already there.
We're partnering with the Farm Bureau in Randolph County for a prep, freeze, and cook class. And we're bringing in a company that's going to bring in all the food and all of the supplies and everything. And we're going to show how easy it is to cook healthy meals and to prep healthy meals that we could just throw in the freezer.
We were going to different communities that did not have health care. So that community champion helped lay the groundwork for moving that mobile clinic out into the communities.
The mobile clinic going to the schools had a lot to do with knowing that there are a lot of gaps in services at the school that the schools couldn't physically do.
The mobile clinic in our area is filling an incredible void that's been left. 30 years ago, our school district, which encompasses 250 square miles, we had two residential physicians that had offices in two of the 6 communities. So accessibility to health care wasn't an issue. Now, 21st century, those offices have closed and we have 0 healthcare facilities in 250 square miles. So accessibility is what this mobile clinic means to us. As we see healthier students, there's a wellness, mental and physical. They are interrelated. We are looking at the whole child. That's not a t-shirt or a bumper sticker. When you address all the social, emotional, physical, and mental needs of a child, they grow, they flourish.
And then they realized, hey, we have a bunch of kids who are delinquent on their sports physicals, so they're not going to be able to participate in sports until they get in with their primary care or they go to convenient care. So we were able to organize an afternoon that we did discounted sports physicals. We got through 27 physicals in a day. So, that was a huge patient need that she was able to identify and communicate to us, and we were able to pull the staff over and get it done. I think it was the same week that they asked for it, we were able to go do it. So it's really kind of expediting those things to, again, keep patients, keep kids, keep all of them from being delayed or kept out of things because of lack of access to care.
One of the benefits that wasn't really thought of early on was the accessibility to our families, but also to our faculty and staff, to be able to have accessibility in real time, not postpone that doctor's appointment. They can walk across the parking lot on their prep time or before school or after school and see a physician or a nurse practitioner.
When we actually decided to purchase our first mobile clinic, the work that the community champion did helped us identify where we needed to go. So we knew exactly what pockets of the population were underserved.
It's listening to people differently and hearing what they have to say and bringing it back, and not always thinking about what's easiest for the organization, but what's easiest for the community.